Hi, I'm Dr. Duffey, and this is the second part of a series of videos about disastrous fallacies about ADHD. Students who have untreated ADHD have difficulty paying attention when they're driving, and they're 6 times as likely to have car accidents. Students who have untreated ADHD are more likely to do drugs, unfortunately. There's an acronym, AAAA, that describes the course of untreated ADHD. The first A is ADHD. The second is affective, which stands for the sadness and sense of failure that leads to some depression. The third is antisocial, which reflects the tendency for students with ADHD to feel more comfortable with people who also struggle and who get into trouble doing antisocial things. The fourth is alcohol, because the person is escaping the feeling they have failed to meet their potential and are with others who drink too much. People who have untreated ADHD may not think twice about things, and they're more likely to get divorced. I believe that predators see the bubbly, scattered person who has hidden intelligence and low self-esteem as someone they can make dependent on them and abuse. Predators sense that they can take advantage of the other person's difficulty in being too distracted to see patterns in the predator's behavior. So there are a variety of consequences of ADHD outside of the classroom. Very recently, the FDA approved Endeavor RX as a software program that has proven successful in improving focus in people with ADHD. Another misconception about ADHD is that psychostimulants affect everyone the same way. There's something called the paradoxical reaction in people who take stimulant medication for ADHD. Instead of being stimulated by it, they're calmed by it. Instead of getting high and speeding on it, they feel serious and calm. Instead of running around doing a million things ineffectively, they can sit quietly and persist at one task at a time. The seriousness and focused quality people experience is not experienced as pleasurable. For example, some students don't like the long-acting version of psychostimulants because they get through with their studies and don't want to still be serious. Strattera and Quellerbri are examples of ADHD medications that should be taken every day. There's a case to be made for the need to take ADHD medications daily to help with the social aspects of ADHD. Some physicians feel the brain needs the steadiness of daily medication. Other physicians believe some ADHD medicines should be taken only on an as-needed basis. Students should take them only when they need to study, to do long-distance driving, or have a tedious work task coming up. On days they don't have much to study, they don't need to take them. Each day is a decision about whether they're needed or not. By approaching it that way, students maintain the medication's effectiveness, allow their heart not to beat the few extra beats a minute it beats on medication, and allow themselves to be their fun, bubbly self. Another misconception about ADHD is that there are no advantages to having it. There can be advantages. A person with ADHD has a brain that is more likely to be creative because it's going off in all different directions. People with ADHD are more likely to think outside the box and come up with novel solutions. People with ADHD are more likely to notice little things, the very same things that distract them, and are more likely to be spontaneous and lively. Others enjoy the off-the-cuff things they say sometimes. So they may ask, if I have ADHD, why am I just noticing it now? A combination of things may have led to you noticing it now. Being bright and having parents who prompted you to do your homework and provided structure to make up for your lack of organization and being scattered may have helped you do better in high school. The material may not have been nearly as hard as it is now. College material gets particularly more complex as you move from sophomore to junior year. People with ADHD have problems with working memory. They can't easily hold the last idea in their head to put it with the next idea to understand the complex explanation the professor was discussing in long sentences like this one. See what I mean? The last misconception I want to talk about today is the one that is most troubling to me. It is the belief that some students have that their parents are inflexible about the issue of their taking medication. I have found many parents, quite rightly, have worked hard with their children to build their child's frustration tolerance and the ability to persist at difficult things. Parents know that life is hard and know that self-discipline is more important than intelligence and whether a child finishes college or not. They want their child to develop self-reliance. I think it's easy for children to assume from their parents' teaching that their parents want to prove what the child fears as relying on a drug rather than themselves. Actually, it's simply leveling the playing field, and the student still has to study. On the medication, it will simply be that it's no harder for them than their classmates. Sometimes when a student says to me, "My parents won't let me take medication," it's a way of putting something off on the parents when the child doesn't want to be told what to do about medication. The child may feel that taking a medication is the same thing as admitting that they're somehow broken and different and have to take shortcuts. I may hear about how the parent is a perfectionist who expects too much, when in fact it's the child's belief. If you are a parent, I hope you'll ask about these ideas and correct your child's misconceptions. Students tell me their parents fear that the medication is dangerous. I would say that all medication is dangerous if taken in the wrong amount by the wrong person. Psychostimulants are no different, and like other medications, they require monitoring and the dose be individualized. What other medications the patient's taking also have to be taken into consideration, as well as a history of heart disease. You can find medication trial instructions, information about accommodations testing, as well as a questionnaire for parents about ADHD symptoms on the Georgia College website in the Counseling Center section under my name. Sometimes children feel they don't want to ask their parents to pay for the medication, feeling it's too expensive. They fail to consider the long-term expense when parents have to make up their losing the Hope Scholarship, which we have in Georgia, or pay for their auto accident, or refinish the basement because they didn't do well enough to find a job that will support them. There are generics of different medications, and some drug companies have programs for those who don't have insurance. If you're a parent, I hope you will talk to your child about what you think the chances of them having ADHD are and the pros and cons of trying medication and counseling for it. Thank you very much.